In Mississippi, COVID-19 is spreading rampantly. The latest data shows more than 4,000 new cases confirmed in just one day. 36 more people have died, and more than 1,600 people are in the hospital as of Tuesday. The University of Mississippi Medical Center added 2 new field hospitals inside parking garages to handle the influx of patients, all in less than 1 week. I want to bring in Dr. LouAnn Woodward. She's the Vice Chancellor for Health Affairs and the Dean of the School of Medicine at the University of Mississippi Medical Center. Good morning, Dr. Woodward. Why did you have to open these field hospitals so quickly? And what's happening at your hospital and in the state of Mississippi right now?
So in the last few weeks, really in the state of Mississippi, we have had an explosion of cases with this Delta variant. We've had every day we're breaking records in new cases that are testing positive, and then hospitalizations, people that are in the ICU, children who are being infected. So we are really in a state of crisis in Mississippi. And quickly, we have exceeded the capacity of our hospitals across the state and the critical care beds across the state. So it is the worst it has been since the beginning of the pandemic right now in Mississippi.
Let's look at some of the numbers in Mississippi. Only about 36% of the population is fully vaccinated. Are unvaccinated people driving this surge? And what would be your message to them, Dr. Woodward?
I can say with absolute certainty that it's unvaccinated people that are driving this surge. As we are looking at our hospitalizations and the patients requiring critical care hospitalization across the state of Mississippi, way north of 90% of these patients are unvaccinated. So this truly is an issue that is tied directly to our low vaccination rate. And I have used so many platforms in the last, year, but really very much more intense in the last couple of weeks, just making pleas for people to get vaccinated. That is really our path out of this.
And that's amid some tragic news. An 8th grader in Smith County, Mississippi, died this past weekend from COVID-19. And in a response to a surge in cases, the school district decided to shut down for 2 weeks. Meanwhile, the Department of Health reports more than 20,000 students were in quarantine last week after being exposed to COVID-19, and almost 6,000 have tested positive this month. Have you seen an uptick in children being hospitalized since school started? And what do you think that these schools need to do to keep kids healthy?
Yes. So every day, basically, our number of pediatric patients in the hospital is going up. Every day when we get the report, it's higher than it was the day before. The number of children that are in the ICU, the number of children that are requiring ventilation, and and this has all been really in these last few weeks since school started back, and people are around each other in these indoor spaces. It's just exploding is really the only way I can explain it. It's mind-boggling, actually. And the thing that we are trying to be sure people understand and trying to get the message out is in kids and in adults, we are seeing younger adults, we're seeing pediatric patients that are basically healthy otherwise. This variant and this surge that we're seeing, it is not predominantly striking people with other comorbid conditions. Young, healthy people are getting very, very sick, and young, healthy people are dying.
Let's talk about monoclonal antibodies as a treatment for COVID-19. We know the University of Mississippi Medical Center just opened a monoclonal antibody clinic. Are you finding it's an effective treatment for people? And at what point are you encouraging people to seek it out as an option?
So it is an effective treatment, and we are very much encouraging anybody who tests positive to be evaluated to see if they meet the criteria. The criteria are very broad. So especially early on, we are very much encouraging people, first of all, to get vaccinated. Second of all, if you test positive for COVID, to consider the monoclonal antibody treatment. That is a tool that we have that can be very helpful to keep somebody from progressing to needing hospitalization.
And one last question for you, Dr. Woodward. If cases of COVID-19 keep rising, will the hospitals throughout the state be able to handle it? Will they be able to keep opening field hospitals to take in the influx of patients?
Everybody across the state, all the hospitals across the state are at their capacity and have exceeded their capacity. People are holding patients in the emergency rooms, taking care of patients in waiting rooms. Larger hospitals around the state that usually are able to accept patients and transfer are having to say no. So this will only worsen. I don't know that there are other field hospitals available. And what does it say when we're at the point where we're taking care of patients in tents and parking garages?
Well, Dr. LouAnn Woodward, thank you so much for joining us this morning. We hope that people heed your advice to get vaccinated and that the situation improves in Mississippi. Thank you.
Thank you. Thank you.